Cardiologist Dr. Edgard Prihadi visits GP practice Vian today to raise awareness among fellow cardiologists and GPs about the importance of iron deficiency in heart failure.
Iron deficiency is highly prevalent in heart failure, with numbers ranging from 50 to 60%. And that's consistent over the whole spectrum of left ventricular ejection fraction. It is associated with poor exercise capacity, impaired quality of life, increased risk of rehospitalization and even mortality, and that's independent of the presence of anemia. There are several reasons why iron deficiency is so important in heart failure. Firstly, it's an important component of hemoglobin, which is responsible for the oxygen transportation throughout the body. Secondly, it has an impact on the mitochondrial function, which impairs the energy production in every cell of the body. Third, it has an impact on increased inflammation, which also has a detrimental effect on the progression of heart failure. Fourth, it also has an impact on the ability of the heart to remodel and react to the detrimental processes of heart failure. So how do we assess iron deficiency in a heart failure patient? We usually use a combination of different tests and also, of course, clinical symptoms of the patient. First of all, ferritin level. Ferritin is a protein that stores iron in the body and usually is used to look at the iron storage in the body. Another test that we can use is transferrin saturation. Transferrin is a protein that is responsible for the transportation of iron in the blood. The combination of using ferritin and transferrin saturation gives a much better idea of the iron deficiency that is present in your heart failure patient. Besides that, clinical symptoms of heart failure and iron deficiency are not that typical. How do we treat iron deficiency in heart failure patients? There have been several randomized controlled trials which have shown that intravenously supplementing iron in these patients have a strong impact on quality of life, exercise capacity, and risk of rehospitalization. There have been some trials with oral iron suppletion. However, these trials have been negative, probably due to the decreased uptake of iron in the intestinal tract of these patients. Regular assessment of iron level in your heart failure patient is important and should be done at least twice a year. This is also according to the European Society of Cardiology heart failure guidelines. Hi.
Hi, colleague.
Nice to meet you. Hi.
Take a seat.
Thank you. Yes, I was very happy to see the flyer on the iron deficiency in heart failure in the waiting room.
Yes, indeed. Yeah, I'm certainly aware of the importance to screen and to detect and to treat the iron deficiency in patients with heart failure.
Yes, I think it's very good that we have a close collaboration on this because we know that oral iron suppletion does not really work. It only works when we give it IV in the hospital. And we as cardiologists can make the reimbursement for that. But of course, it's very important to have a regular screening with ferritin, transferrin saturation in the blood test.
Very good to know. So the collaboration between the GPs and the cardiologists is very important. Certainly because of the IV treatment only is possible in the hospital.
Yes, absolutely.
Thank you very much. Pleasure meeting you.
You too. Bye-bye. See you later.
See you.